Hi, welcome to Vet Candy Rounds with the Hawleys. I'm Dr. Tierra Hawley.
And I'm Dr. Quincy Hawley.
This show is brought to you by Brave Paws Anxiety and Stress Support Chewables for Dogs. Thunderstorms, vet visits, fireworks, separation anxiety, and more. Every day can be a Brave Paws day. Check out mybravepaws.com.
We love our fur babies so much, but when they're stressed out, it makes us stressed out. Some dogs hate loud noises like thunderstorms and fireworks, and sometimes they just don't want to be left home alone. To help keep them calm in moments of stress, use Brave Paws Anxiety and Stress Support Chewables for Dogs. These plant-based chewables promote calm behavior with natural ingredients that have been clinically studied. Did I mention they're fast-acting and non-drowsy? I especially love that Brave Paws helps farmers in Costa Rica by sourcing ingredients from a woman-led co-op that uses reusable energy and regenerative agriculture. How cool is that? Learn more at mybravepaws.com.
All right, so Vet Candy Rounds is basically a show. It's almost like we're taking it back to vet school. So we are going to be interviewing or speaking with a specialist, and we're basically going to be like the vet students, and they're going to talk to us about a case, and we're going to discuss it and go from there.
Yep, and so we have a mystery case, and we're going to try to solve this mystery case. And on today's episode, we have a very special guest, Dr. Lillie Davis, who is an oncologist out of Philadelphia. Welcome to the show, Dr. Davis.
Thanks so much for having me. I'm so excited to be here.
Okay, and again, Dr. Davis, welcome to the show. Can you tell us a little bit about yourself, where you're from, where you're practicing, where you went to school, things like that?
Yeah, so I completed my undergrad degree in 2009 at Cornell University. I'm originally from the Bronx, New York. I went on to complete my DVM or degree in veterinary medicine at Cornell in 2014, did a small animal rotating internship at Purdue University in 2015, and completed a small animal medical oncology residency at Cornell University in 2018.
Wow, that's really awesome. And thank you for sharing all of that, Dr. Davis. Now, just to tell you a little bit about our show and how this works. So as Dr. Hawley mentioned earlier, we're going to have a case, or you have a case, and it's probably a really cool case, I would imagine. And you're going to tell us all about it. And we're going to try to guess and figure out what the diagnosis is. So we'll ask you questions about the history, ask you questions about the clinical signs, what tests you're running, and then at the end, what treatments you use and the outcome of that case. And so with that being said, what do you have for us today?
So our patient today is named Sky. Sky is an 8-year-old female spayed Labrador retriever, or Labradoodle, sorry. Sky is an 8-year-old female spayed Labradoodle who presented to her primary vet for a dermal ulcerated mass of her right distal pelvic limb.
Okay, so we have this lump. What does the lump look like? Can you describe the appearance of it?
Yeah, so Sky presented for a dermal ulcerated, approximately 2 centimeter mass of the right distal pelvic limb. Otherwise, clinically fine, eating, drinking normally, no vomiting, diarrhea, coughing, or sneezing.
Okay, Dr. Davis. So it sounds like we have an 8-year-old female spayed Labradoodle, and we did an in-house cytology. And what were the results of that test?
So fine needle aspirates were performed, and in-house cytology revealed these very well granulated round cells underneath the microscope.
Okay, Dr. Davis, so it sounds like there were no other abnormal clinical or physical exam findings, but we did have well granulated round cells on the cytology. And so, Dr. Hawley, what are you thinking when you see well granulated round cells on the microscope? What's your top differential for that?
For a pet of that age, I'm thinking mast cell tumor.
I agree 100%. And so is it mast cell tumor, Dr. Davis?
Yes, it was definitely a mast cell tumor.
Okay, so it was confirmed to be a mast cell tumor, But Dr. Davis, mast cell tumors, they really aren't that much of a rare type of finding or rare type of case or diagnosis. So is there more to it than that?
The primary vet performed an abdominal ultrasound, which was unremarkable, and then surgical excision was performed, and the mast cell tumor came back as a grade 2, high-grade, incompletely excised mast cell tumor with mitotic index of 5.
So we have this mast cell tumor. What did you do about treatment?
Yes, so the biopsy report indicates that this mast cell tumor is pretty aggressive as it's high grade and the mitotic index is pretty robust, which means it's greater than 4.
Okay, Dr. Davis, so we incompletely surgically excised the mass, and this mass also has a high mitotic index. And so it sounds like this tumor may be one that comes back.
So we have this highly aggressive tumor that, was excised with bad margins. Like at this point, did the referring DVM refer this patient to you?
No, I mean, they should have referred this case. It ultimately gets referred, but this would have been the nice point to refer it to an oncologist.
So then instead of referring, what type of treatment did they prescribe to this pet?
At this point, Skye was placed on prednisone, famotidine, and diphenhydramine. Initially, it turned out well, but unfortunately, Skye became intolerant to prednisone such that she developed pretty severe increased thirst, urination, and increased appetite, and she gained a significant amount of weight. Also at that time, she developed 2 severe skin infections and urinary tract infections as well. So unfortunately, she had to come off of prednisone completely.
Would this be effective for this patient?
No, actually what happened was the worst part of this entire story. So after she stopped prednisone, shortly thereafter, the owners noticed that Skye unfortunately developed innumerable ulcerated, weeping, serous sanguineous discharge, seeping masses all throughout her body. We're talking this dog was covered with mast cell tumors everywhere. Or masses everywhere, masses everywhere.
Ooh, ouch. Wow, that sounds really bad.
That sounds like a nightmare, honestly.
Yes, thankfully they did refer her to me. So at that time, her quality of life surprisingly was good outside of the fact that these masses were extremely itchy, and they were also making the owner's quality of life pretty miserable in that these masses were bleeding and seeping all over their house, and it sounds like Skye would sometimes lose sleep from how itchy these masses were. The dog, or Skye, was then put back on Benadryl at that time, which did not seem to help at all, and the owners reported that these masses kept popping up more and more as time went on. So what I did when I saw Skye was do clinical staging, which includes full blood work, abdominal ultrasound, and chest x-rays, as well as aspirating the local regional lymph nodes, which pretty much were all of them.
Okay, Dr. Davis, so what were the clinical exam findings?
Yeah, so she was covered in these pretty ginormous, wet, ulcerative lesions. However, along with that, her inguinal lymph nodes were really big, and her left popliteal lymph node was very big and firm as well. She already had a high-grade mast cell tumor incompletely excised, and these masses popped up pretty fast and grew pretty quickly, which are telltale signs of high-grade mast cell tumors.
Wow, I mean, this case to me seems like hopeless. Like, is there really anything that you can do to help this dog?
So we found that on further staging tests, she did, unfortunately, as I suspected, have metastasis of her mast cell tumor disease. I did final aspirates of her lymph nodes, the enlarged lymph nodes that is, and microscopically there were mast cells everywhere. Abdominal ultrasound also did show lymphadenopathy within the abdominal cavity, consistent with mast cell tumor metastasis to the lymph nodes within her belly. Fortunately, her spleen and liver were overtly unaffected. So at that time, I discussed with the owners the prognosis for Skye, such that We generally treat mast cell tumors primarily with surgical excision. However, we knew that in this case, surgery of these masses would be impossible due to the large number of masses that were present, and also the mast cell tumor disease had already metastasized. So at that point, the only treatment option we really had at our disposal was systemic chemotherapy. I discussed several treatment options, of which included oral chemotherapy with lomustine, which is given every 3 to 4 weeks, by mouth. But that does have some side effects that these owners were not really willing to risk, such as severe immunosuppression and potential liver toxicity. The other treatment that I did propose or offer was injectable vinblastine, which is given weekly for a month and then every other week for indefinitely for her, which they could not afford, nor did they have any interest in coming to the vet every week indefinitely. So the last treatment option that they ended up choosing was oral toceranib phosphate, which is given at home by mouth on Monday, Wednesday, Friday. And that was not coupled with prednisone because of her severe reaction to steroids previously, although I commonly do add in prednisone to the chemotherapy protocols.
Okay, and so how did Sky respond to the treatment?
She did miraculously. So generally after starting this treatment protocol, I see my patients back within 2 weeks to assess their response to therapy, which generally takes about 4 to 6 weeks. So I did not expect much at this time, but I usually see them back to make sure they're tolerating the drug well. So I recheck blood work at that time. But for Sky, within 2 weeks, half of her masses were gone, which was amazing. The owners stated that she was severely less itchy. They were amazed. They were so happy. So initially, she did great, but I did end up seeing her back again.
That's really awesome. I'm so glad to hear that Sky's tumors are receding and going away, and that she's doing much better, it sounds like.
That's terrific, yeah.
Okay, so it sounds like Sky was doing better, but did she stay better with that treatment?
Yeah, so initially within the first 2 to 6 weeks, her disease went from partial remission, meaning 50% of her lesions were gone, to near a complete remission. So all of her big, open, ulcerative wounds were completely gone. The pictures of her, are stunning in that she looks like a completely different dog. The owners were so happy and elated. But unfortunately, about a month and a half in, she did develop pretty significant diarrhea that the owners found to be intolerable, even with supportive medication. So at that time, we did have to finagle her treatment protocol and give her treatment holidays, decrease her dose a little bit. So it did become a bit tough in terms of her quality of life actually became impacted by the treatment that was working wonderfully for her mast cell tumor disease.
Yeah, so I guess you can expect that to happen with this type of cancer. I hope the owner was able to have some time to say goodbye to Sky.
She did pretty well for some time. She was on the drug for about 6 to 8 months, but yes, unfortunately, after that time, her lesions did come back and her quality of life became poor again, and the owners at that time elected to humanely euthanize and not pursue other treatment options. She had a really good 6 to 8 months of wonderful quality of life, and her disease didn't progress as quickly as it came on, so they did have time to have closure. I did offer them additional chemotherapy options, which they declined at the time. And so generally speaking, I tell my clients and my primary vets that the goal of chemotherapy is to control the disease, but to also ensure that the animal's quality of life is as good as possible in the face of side effects. Most dogs generally tolerate the drug that Sky was on pretty well. While diarrhea is a very common side effect of toceranib phosphate, it's usually pretty well managed, but Sky was a very sensitive dog, and it just found to be pretty challenging. And her disease, as it ultimately ends up being, was refractory in the end.
Okay, Dr. Davis, so this seems like an atypical type of mast cell tumor case. Is that correct?
Yeah, you're right. She's definitely not the normal mast cell tumor case at all. She was, in fact, the most striking mast cell tumor case I've seen in my career. Normally, when dogs present with mast cell tumors, how it can occur is in several different ways, which is actually what makes this disease process pretty challenging to treat. So for example, I've seen dogs where owners are like, they've had no masses their entire life, but 2 weeks ago, I noticed this lump form on their hind leg, and it started off as a grape, and now it's a golf ball, and it's ulcerated, and it's bleeding, and it's necrotic. That's one way they can present. The other way I've seen them present too is owners say, oh yeah, Fluffy's been lumpy their entire adult life, and there's this one mass that's been there for years, but all of a sudden, this mass is starting to grow and shrink and grow and shrink. And that fluctuation in size is actually really characteristic for mast cell tumors.
So, what are your recommendations for us GPs who are dealing with mast cell cases?
Oh, that's a really good question. So normally, when you have a mass that you suspect is a mast cell tumor or cancer in general, I generally tell primary vets if they're going to pursue surgical excision with them, the primary vet, I highly recommend aspirating the tumor to ensure that, yes, this is cancerous, because that gives the vet an idea that they need to try and get adequate surgical margins, meaning they need to get enough normal tissue around the tumor so that they don't just remove the tumor and leave cancer cells behind. They remove enough normal tissue so that there's no chance of recurrence as excision is complete. So I usually tell referring vets to ensure that they're comfortable removing the tumor surgically with complete margins. If there's any doubt whatsoever, then I highly, highly recommend that they refer those pets to a surgical specialist.
So aside from surgery, are there any other alternatives to treating local mast cell tumors?
Yeah, this new local treatment is called tigenolol tigolate. It's a novel diterpene ester that's actually derived from an Australian rainforest plant. And what it does is, again, it's injected into the mast cell tumor and causes necrosis and tumor cell death, and it forms a wound that heals over. And the initial studies have shown that the response rate, or the complete response rate's pretty high, and that 80% of dogs who receive this injection who have mast cell tumors, they have complete resolution of their mast cell tumor.
Wow, that sounds really cool. We actually heard about that drug. It's almost like a miracle or wonder drug, it sounds like, right?
Yeah, I actually can't wait to get the opportunity to use it on a patient. I'm just waiting for the right candidate to come along to try it out.
I, as a medical oncologist, see them very often, and I do think that veterinarians in general see them all the time, whether they know it or not. They're a very common tumor type in dogs in that they make up 12% of canine skin tumors. So they're pretty common.
Right. So is there anything that could have been done differently earlier on with this case that could have improved her outcome?
Yeah. The best thing that could have been done in hindsight for Skye is when she initially presented for the lump on her hind leg that was incompletely excised by the primary vet and came back as a grade 2 high-grade mast cell tumor. That, once a vet gets a biopsy report indicating that a mast cell tumor is high grade, that pet should immediately be referred to a medical oncologist. And then in that instance for Skye, we would have done more complete staging to assess her for any possibility of metastasis at that time. As we know, high-grade mast cell tumors have a 50% chance of metastasizing, and up to 95% actually, so they can be pretty nasty things. The best place to find a veterinary oncologist is usually your closest specialty referral hospital. Most of them do have oncologists, but there is a database online. Us oncologists are a part of a group called the Veterinary Cancer Society, and I'm pretty sure there's a directory on that website that primary vets can utilize to find their closest medical oncologist.
So Dr. Davis, there are a lot of different specialties out there. We have cardiologists and neurologists. What made you decide to become a veterinary oncologist?
Yeah, that's a great question. I actually wanted to become a critical care doctor when I first started vet school. I thought that was my fate and my destiny until, as a fourth-year vet student, I took the oncology rotation, and within 2 weeks I fell in love with the specialty because cancer, while it's devastating and really sad, is an interesting disease process, and finding ways to conquer cancer and make my patients' quality of life better and therefore improve my clients' quality of life and happiness was just, unmatched compared to any other specialty that I had exposure to at that time. The human-animal bond is so poignant when it comes to oncology, and it's just so nice to have that, to be that point of care during that pet's end of life, and to make sure that their end of life is as excellent as possible. And of course, we want them to live as long as possible, but the real goal truly in medical oncology is to ensure that my pets, as I always say to my clients, they're blissfully unaware of their cancer. They have no idea that they have cancer outside of the fact that they come to see me with some regularity. But I tell my owners, when you bring your pet to see me and I ask how they're doing, I want you to say fantastic, better than they've done in a very long time. And having that connection with the pets and the clients is truly what drew me to this specialty, and it's very rewarding. It's funny because when I have students rotate through oncology, or I talk to my clients about starting their pets on chemotherapy, they're pleasantly surprised at how positive the entire experience can be. It is sad, and that's not to downplay how devastating this diagnosis can be for many families, but again, it's the goal is to make that end of life excellent and to get my clients and my pets that closure. Yes, we're trying to delay the inevitable, as a lot of my clients say, but we're trying to make that time frame as wonderful and peaceful as we possibly can.
Well, thank you again, Dr. Davis, for coming on our show and sharing your expertise with our viewers and listeners.
Everyone can find me on LinkedIn or on Instagram at Dr. Lillie Davis.
Well, this concludes another episode of Vet Candy Rounds with the Hawleys. My name is Dr. Quincy Hawley.
And I'm Dr. Tierra Hawley.
Please be sure to like, subscribe, and to share this video with your colleagues if you enjoyed it. And again, thanks for watching, and don't forget to follow us at My Vet Candy.